You don't need so much to actually feel better and feel healthy. It's definitely useful if you have a sensation of safety, a roof over your head, that you can have food and you can have network, a relationship. Those are kind of base for health, but you don't need that extra watch, you don't need that extra feature on the car to get healthier, especially if you cannot really afford it. Hey, today this content is about health, but this time I'm gonna address the social component. So I have a tendency to follow the biopsychosocial framework that Dr. Engel in the 1980s developed. He was a psychiatrist and decided to look at a broader picture as opposed to a single point. So sometimes people could have pain, physical or mental pain. In his case, he was addressing, as a psychiatrist, people with mental health. And he looked at the bigger picture. He looked at the body could be involved in this. He looked at the mind could be involved in this, the psychology, of course, but also the society could be involved in this. So how can we solve a bigger problem? So as a massage therapist, as a health coach, as a person who is doing meditation guidance, I tend to address most of the biopsycho, but sometimes I want to dive a bit more with you with the social, because this is something that I can't do alone and no one really can. You can organize a societal change, though, when you interact with other people. So I'm gonna give you some ideas on that. So if you're struggling mentally and physically, that could be very helpful, especially if you have social skills and you want to develop programs or non-profit that can help society at large. It's useful to have an idea about these biopsychosocial concepts and how the social component kind of fall into place when people can struggle physically and or mentally. So here we're gonna talk about stressors. The stressors, what I mean by that is something that is stressing you. It puts a stress on the system. So you have positive stressor and negative stressor. If you exercise, it's a positive stressor. If you do it in a healthy way, it's gonna put a stress on your body, but really it's at the end of the day a good thing overall. And then you have negative stressors. If you think about tax, finance, people can be triggered. I know I am, so maybe that's biased when I choose those ones. When you choose those, you can feel a negative stress. Maybe you have some trauma around it, like some apprehension about it, and you're not feeling comfortable with it. It will increase your stress. Those are mostly common in the US society. There's health insurance is a big stressor. Not everyone has health insurance coverage, and it actually increases the stress of a person. So you could have someone who said like, I'm struggling, and you tell them exercise and all those positive, meditate, all those positive strategies. But if they don't have health coverage, no amount of meditation or exercise will bring their space clean. It might help mitigate stress for the moment, but it might not change their life. So you want to keep that in consideration. Now there's others, revenues, kids, marketing, and social media. So revenue, it's about how much money you make or if you make enough or not. And that can affect your mental health as well. Kids, if you have kids, I don't need to go deep into it. If you don't, just imagine the stress that it is to raise another person. It is beautiful. I love it. Personally, I have 3 kids and I love them. And they take everything and give everything. So they will help you grow, they will challenge you, but they will face the hurdle and you have to kind of navigate that with them or just figure out how to navigate yourself in that relationship. So it is a big mental health growth, but it is also a stressor. I will put that in a positive category of stressor. Now, marketing and social media. Marketing has put a lot of strategies to make you want to buy something, to think that's what you need to be happy. And it created the FOMO, fear of missing out. If you don't have that, you won't be happy. It's kind of like the bottom line. And if you don't do it right now, so there's pressure tactic, there's scarcity tactic, there's a great book on marketing that explains to you how you can manipulate the psychology of an individual, use their weakness to get what you want, to sell what you want. That's why I do a lot of free content, because I want to put out there also material that people can access without paying the fee to work with me. I want them to progress without having to feel stressed about how much it will cost. Now, you don't need so much to actually feel better and feel healthy. It's definitely useful if you have a sensation of safety, a roof over your head, that you can have food and you can have network, a relationship. Those are kind of base for health, but you don't need that extra watch, you don't need that extra feature on the car to get healthier, especially if you cannot really afford it. So be mindful about that. It has changed society at large greatly, especially with the access of social media. So you see video where there's a lot of body dysmorphia. People will go into wanting to look like the filter you have on some Instagram. And that has created a lot of mental stress. Oh, also you can see, they do this, I should do that too. Oh, I can't. So there's a lot of that stress that we put in our culture. The idea that you compare yourself to others, the idea that you are isolated, you feel like you're not as good as that other person who's posting amazing pictures of them in Italy or in Greece or in South America, around the world. I don't see those people as being part of the problem. That if you can travel and share pictures, it's amazing. I think it's beautiful. It helps me travel when I see other people do. But sometimes it can put a pressure onto some of the people who cannot really access that idea that if I travel, I'll be happy. Keep in mind of those strategy of social media and of marketing, they are useful. You do want to present something in front of people if you have something of quality, and you need to have them consider if it's useful for them. So there is a benefit to marketing as long as it's presented for something that I think is beneficial, useful for both parties, and ideally like can help also the environment. Like that's my bias. I tend to want to create a bigger project when it comes to physical, mental, and societal health. So, but think about it. And when you look at social media, do you feel pressured? Do you feel like the videos in social media are making you feel good even after you watch them? Or good only when you watch them and then you feel down? Or do you have also maybe an idea that you're feeling overwhelmed by all the quantity on the social media? Are you being cyberbullied? Do you have a problem with, so here with the addictive is a dangerous word, but it is a word that came up. For example, my kid at school had the English teacher says, you guys are addicted to your phone, so we need to put your phone in prison. It's phone jail. And there's a little cute board on the wall where it's phone jail and you put your phone in it. And I asked them, instead of saying that they're addicted and there's a phone jail, maybe we can do something like, this is not something where you are addicted, but maybe this is something that could distract you sometimes. That's fair enough, right? You can be distracted with your phone. And instead of phone jail, maybe we call it like a phone nap area. So it has a connotation of like, the phone is not going to jail, the kid is not addicted. There's not all that weird connotation of we're dealing with drugs. Social media, phone are created to stimulate your hormonal system and make you want to use it more. And there's no doubt about it. But at the same time, they are a powerful tool that can connect us more. So if you can see the risk and see the potential use, it's like a car. You could get into a car accident, but by driving, you're able to go further or to have more convenience and travel. So social media marketing are tricky beasts, but they do intensify the stressors on our society. And by the way, it's not exactly the same thing. I'm French, and in France, labor market strikes, terrorism strikes. French people strike a lot. Terrorism, cultural identity are more the stressors. So there's not the same thing with healthcare, because in France we have universal healthcare. So when I was in France, I never was stressed about going to see a doctor. It was costing me about $20 and it was reimbursed by Social Security. And to this day, it might be still $25 to go see a doctor, and you have easy access to doctors. And you can just go in, some days you just pop up in their room. There's no waiting list. There's 10 people. You wait your turn and you pay, or you give your social security card and they use it like an ATM card and they get paid by Social Security, our taxes. So France doesn't have the same stressors, but strikes. Oh, strikes. Now let's go a little bit to the help and the solutions here. Like if you have all those stressors, what can you do? And I didn't mention all of them: financial insecurity, job insecurity, political polarization, racial and social injustice, housing. There's a lot of stressors, and some might affect you, some might affect someone you know. What are the solutions? So some of the solution will be to actually look for help from your close circle or from a broad circle, from professional or personal help. This is a bit the idea here. When you have pain and discomfort, physical and mental, and you know that there are some social stressors that you as an individual cannot change. I as an individual cannot change healthcare system in the US. So I'm getting help by talking to insurance brokers, talking to my CPA, talking to other insurance people, doing some research online, asking other people who have health insurance, what do you do? How much do you pay? You obviously want to ask them if they're okay answering you. Not everyone is. But if you come from a place of candor, people might simply just tell you. And you'll realize you're not alone. A lot of people have some of those issues out there that I've talked to. You also want to consider keeping those healthy strategies. So even if exercise, meditation, eating properly will not change healthcare in the US, you staying at your peak, at your healthiest, will help you make better decisions, will help you with handling stress, will help you with handling pain. At least that's the idea. So the base are meditation, going in nature. Actually, in some part of the world, doctors give as part of their recommendation for their patients to do nature therapy. They go walk in the wood, and there's benefit to it. So look at all of that, try to figure out how you can make a part of that in your life, and hopefully that will help you feel a bit better, a bit less lost, have a sense of direction, and maybe you'll create some social change. I'm looking forward to sharing more with you soon.